Hello, hello, hello. Good afternoon, everybody. Good morning. If you're still in the Pacific time zone or somewhere else, my name is Dr. Heather Stanley-Christian. I am the founder of Unity Maternal Fetal Medicine, where our mission is to help anybody who has a uterus that has a pregnancy and a thought, a question, concern, or complications, to help them get through the pregnancy to achieve their best outcome. I wanted to do this particular topic of placentation and grading today because I had a patient who came in extremely stressed and worried because she was told that she had a grade 2 placenta and she was only in her second trimester. And of course, after hearing that, she went for a second opinion with Dr. Google, and that did not reassure her. So she ended up in our space, and I'm going to tell you what I told her. And she actually said, I wish somebody would have said this, and she was one that gave me the idea. So if you're listening, I am going to talk about this. It's not a topic that we talk about a lot, if ever, because placental grading is sort of like your great-grandmother's old china. Looks nice, not really worth anything, but it kind of has sentimental value, so it's stuck around in your mom's or maybe your house. But let me give you a little bit of the background of that. The late Dr. Peter Grading from Yale University came up with this placental classification system with a thought to sort of help pregnancies. Like if we could see a thing on ultrasound and is that thing predictive, then maybe we can do an intervention or more monitoring. That was the whole purpose of ultrasounds. So back in the day, in the 60s, 70s, when ultrasound was still coming out and we were just very curious as scientists, like, ooh, what about this? Is this associated with that? Well, Dr. Grading had that curiosity, and he looked at these calcifications, these little bright spots in the placenta, along with some other things, and kind of came up with a classification system. So this was, I think, in 1979. So in the early 80s and the mid 80s and the late 80s, as the data kept rolling in, because every scientist was studying it, by the late 80s, early 90s, we found that really there wasn't a correlation that was even strong, wasn't even weak. It was just very, very weak. So with homage to the late Dr. Peter Grading, we thanked him for all his years of watching and helping us understand aging of placenta, but it really didn't add to the clinical management of our unseen second patient. However, if you're getting your ultrasounds at certain places, I will tell you from the obstetrical milieu and the maternal fetal medicine milieu, we no longer even talk about grading. Because it has no validity, no usefulness. Now, there are other things of the placenta that's pretty important. For example, the size of the placenta. Are there additional lobes that are close to the placenta but not of the big mass of the placenta, where the umbilical cord is inserted into the placenta? Those and some other things, yes, does have some utility. But is there a grade 1, a grade 2, a grade 3? It doesn't really add much value. And in fact, I would encourage you to kind of put this in the context of where it needs to be. My personal opinion is that it needs to be in the OB Smithsonian Institute as a great historical fact, but it really doesn't confer any added value to the ultrasound. So in summary, grading of the placenta is really, it's fallen out of obstetric practice. There are some people outside of OB and MFM who are doing ultrasounds who may have been taught about it or are still being taught about it, but it's really the function of the placenta which we're really more interested in than how the actual placenta looks. So just think about the placenta like Quasimodo. Might not be looking all that like what we would expect, but as long as it's functioning and baby's growing and there's no issue with growth. So what if the placenta has calcifications? So I am going to leave that there, and I'm going to say thank you so much for coming by, checking in. Again, my name is Dr. Heather Stanley-Christian from Unity Maternal Fetal Medicine, and you can check us out at Insta at UnityMFM. Have a wonderful day. Walk good, okay? Happy hump day. Bye.